The sisters came from Savannah, and it was the whole state of Georgia was one diocese, and it was the Diocese of Savannah, and Bishop Gross was the bishop who asked them to come. So I can only imagine what it was like to travel what is now a 4-hour drive on good roads, but it must have been horrendous. Atlanta had a population that was a little under 40,000. It was becoming a metropolis. The story is, and people say it's fairly credible, that the 4 who came from Savannah had 50 cents. And they had to have had just an incredible faith because they started from nothing. They established themselves connected with the pastor of Immaculate Conception Church, which we still work with here in Atlanta. That's where our sisters first got their support. And then they were given philanthropic help, took over a little 2-story building, a house, and the Atlanta Constitution recognized their coming and said, we finally have a hospital under the Sisters of Mercy. The community very quickly got the name the Walking Nuns because they did not stay inside and the people came to them. They went outside to the homes of the poor, and that was their reason for going out. That became really, really meaning to us with Mercy Care, that going out to where the people are and finding them and bringing them in if they choose.
So it's a team effort. It's always a team effort with us. You know, I've been here about 13 years now, since '02, and you know, I love it. It's home for me. I wouldn't work nowhere else.
It's pretty intense sometimes, you know. You're approaching people. They don't know you. You don't know them. They don't know what to expect. You don't know what to expect. But it definitely is rewarding to see them wanting to receive services and seeing the end result, you know, after they go through the whole process and they see you later and they're housed and they're receiving, you know, the necessary medications required. I think that whoever gets involved in this field, they should have an intent to want to help, no matter how it turns out. Just have the desire to want to help someone.
They are every bit as courageous and risk-taking and innovative as the sisters who were the Walking Nuns in Dublin. And when I think of the ones who are doing street medicine at night under the bridges, they certainly are doing work that is just as hard as the people who traveled across oceans to go out and care for people. It is a place where mission is not just what everybody gets, but what everybody comes to give as well. All religious communities took vows of poverty, chastity, and obedience. Catherine McCauley added a vow, and it is a vow, the service of the poor, sick, and ignorant. So service is really the charism. Service to those who are most in need, service to the poor, whether they are plain poor or whether they're poor and can't get education, whether they're poor and can't get health care, or even if they're sick and not materially poor, but they experience a poverty of sorts.
Mercy Care and organizations like Mercy Care that are taking care of the most vulnerable populations, they got the idea of population health long before the rest of the healthcare industry got it. Because we're driven by looking at all the needs that the individuals who come to us for help. And so when you're looking at that comprehensive need base, you tend to start to put into place services and responses to those needs that are wraparound services. And then you're finding yourself taking care of the whole person. When you start adding things like case management and looking at housing issues and nutrition issues and adding behavioral health into your healthcare model and addressing, you know, things like transportation. I mean, we've been helping people get to medical appointments for a long time. So when you come to a clinic and you can get primary care, dental care, behavioral health services, vision, diagnostics, and that person is really got an individual who's centered around addressing all those needs, that's population health.
I think we've, shared so much of how the past and the present have meant in our own lives and recognized that in all truth, we've been given a gift. It's a work of all who believe, who want to do good. And so my hope is that it will simply continue to be enriched by strong persons who have a kindred spirit, who want to go out walking among the people and really recognize as gift something to be passed along to future generations.